Which receptor helps in improvement of insulin resistance in diabetes mellitus type 2 with regular exercise and physical activity? Every year, 2-3 questions can be regarding only glucose transporter or the drug which is acting on the transporter or the type of transport. A lot of things can be asked. It is one of the most important questions in the recent years. So what is your answer? When you are doing exercise, exercise is equivalent to the function of insulin. Yes, very good. Very good. Answer is B. So most of you are correct, GLUT4. So what is the function of GLUT4? Insulin act on which receptor, doctor? Tyrosine. It act on tyrosine kinase receptor, and then it will cause peripheral localization of GLUT4. Where? In the adipose tissue and in the skeletal muscle. And exercise are also equivalent to insulin. Just imagine if you are even walking for half an hour or 1 hour, you are giving your beta cells some rest, because some of the action of insulin will be equally performed by simply walking. So a moderate amount of exercise can help you in decreasing the insulin resistance. So exercise can also help you in translocation of GLUT4, so glucose can enter in the adipose tissue and skeletal muscle. Can any one of you tell me the exact mechanism of insulin resistance? Can any one of you tell me the exact mechanism of insulin resistance? Why we develop insulin resistance? Why our insulin is not acting properly? Why receptors are not functioning properly? It is a common question for physiology and biochemistry. Who can answer my question? What is the exact mechanism of insulin resistance? Okay, let me tell you. Normally, whenever insulin comes, it causes phosphorylation of tyrosine kinase. But whenever we have central fat, whenever we have central obesity, this causes serine, threonine, phosphorylation of insulin receptor. Now, this is going to be a very, very important question for your exam. So the exact mechanism of insulin resistance is, normally whenever insulin will come, it will phosphorylate tyrosine residue. But when we have central obesity, free fatty acid will damage receptor by causing serine phosphorylation. And now this will not work at the level of GLUT4. So now GLUT4 are now translocated. Clear? Now you know GLUT4 is in the adipose tissue and muscle. Exercise will enhance this. GLUT1, RBC, brain, cornea, placenta. GLUT2, beta cell, liver, intestine, kidney. GLUT3 is like one only, brain and placenta. GLUT5 is for fructose, spermatocyte, GI tract. SGLT1 and 2 we have discussed. It is both in the kidney, but only SGLT1 in the small intestine. Brain prefers glucose but may use ketone bodies during the starvation. RBs utilize only glucose as they lack mitochondria. Now, what are the organs? Those have glucose insulin independent glucose uptake. The mnemonic is brick lips, brain, RBC, intestine, cornea, kidney, liver, islet, placenta, and spermatocytes. They are having insulin independent glucose absorption. I mean, they are not dependent on the insulin. Even if we have insulin resistance, even if we have diabetes mellitus, even then these areas will keep on getting the glucose, because the entry of glucose is insulin independent. Clear? Now you can see here how insulin causes peripheral location of GLUT4. So glucose enter the cell and causes cell growth and development, and also entry of glucose in the cell. Okay, and this is how entry of glucose causes release of insulin from beta cell. So whenever we are eating food, glucose will enter inside the cell, and this glucose will increase the ratio of ATP and ADP, and it will close down ATP sensitive potassium channel. Now potassium will increase, it will cause influx of calcium, and calcium start releasing the insulin. This is called as insulin release from beta cell. So remember, whenever there is a glucose, it will close ATP sensitive potassium channel. Even sulfonylurea like glimepiride, gliclazide, these all are working on the same receptor, ATP sensitive potassium channel. Clear, doctor?